Could you imagine investing money in the bank and when you tried withdrawing it, the money wasn't there because all this time you've been putting it in the wrong place, into another account? It's absurd to think something like this could happen, but this might be happening with your patients and their medication. A 2007 study at Universidade Federal de São Paulo indicated that 60% of glaucomatous patients had inadequate eye drops installation. So, we decided to check how the patients in the glaucoma unit at Instituto de Olhos Ciências Médicas used theirs. Our approach was to offer eye lubricants to the patients who were waiting for appointments and ask them to use it as it was their regular medication. Patient cooperation was very high. 41 patients agreed to participate, and most of them were happy to find out if they were using their medication correctly. The results were that 21 patients had inadequate installation. Their errors were varied: dripping outside the eye, not realizing that the drop had not yet dripped, touching the eyelids with the bottle, and using empty containers thinking it still had medication. Numerous patients informed us that they had never received any guidance on how to use it. Usually, the only instructions they got were on the dosage and frequency. Check this next patient.
É assim que se opina em casa? Então tá bom.
This lack of knowledge made us curious if the problem is exclusive to patients or are healthcare professionals, people theoretically educated in the subject, also a part of it. To look into this, we asked 12 graduating medical students at Faculdade de Ciências Médicas to show us how they would use the eye drops if they had to. The results were 7 students had unsatisfactory technique, a surprising finding as the percentage of errors were similar to the patients. These findings made us wonder if unsatisfying treatment results, such as high intraocular pressure, in large part doesn't happen due to inadequate installation. Therefore, we oriented the patients on how to use the eye drops correctly to check if there will be any impact. The instructions given were: tilt your head back and look up. With one hand, pull your lower eyelid down and away from your eyeball. This makes a pocket for the drops. With the other hand, hold the eye drop bottle upside down with the tip just above the pocket. Squeeze the prescribed number of eye drops into the pocket. For at least a minute, close your eye and press your finger lightly on your tear duct. Also, to prevent infections, you should wash your hands before starting and don't let the tip of the bottle touch anything, including hands, eyes, and eyelids. After explaining the proper technique, we asked the patients to use the eye drops again. This time, the results were much better. Of the 21 patients initially using it incorrectly, 15 of them now had an adequate performance, and all of the students performed greatly. So, we found that with proper guidance, it is possible to improve the way in which they use it. An interesting observation is that adequate installation isn't directly dependent on good vision. Some low vision patients, if properly instructed, can use their medication accurately, even alone, like this one. Finally, with the adequate use of eye drops, it is likely that the patient will have more effective results. So make it count. Be sure your patients are putting their investments, that is, their medication, in the right place, through quality chair time explaining the adequate installation technique.